afternoon, everybody. I got involved in social entrepreneurship completely by accident, and I only found it was called social entrepreneurship about 5 years ago when I won an award for it. My highest qualification is matric, which I struggled with because I can't spell. And so I'm really giving you a sort of down and dirty presentation on what I really do every day and why I do it. And you can formulate that into some plan that fits with your agenda. In 1982, my second daughter was born with severe disabilities. I was told by the urologist and the pediatrician to put her in a home and have another baby. And I felt absolutely deflated and shocked that the medical profession would only have that as an option. And of course we were in the middle of sanctions at that time, so nothing was available here. I couldn't get equipment. I didn't even know what equipment I needed, but all I did know was I needed to do something about it. And that her quality of life was as important as my other children's quality of life. By the age of 18 months old, she was up and driving her first electric wheelchair, which we built for her. I got some pictures from a magazine that's long before internet. Some magazines from Sweden, from a cousin of mine, via airmail. And she brought over a set of wheels and motors in her rucksack on the plane. And we built this with the Department of Biomedical Engineering at UCT. When I started this, I had no idea where it was going to lead to. The first step was my starting a non-profit organization together with some therapists who were working with my daughter called Interface, which was focusing on early communication and alternate ways of playing and interacting. From that, I met many other parents and started realizing that the barriers to education were massive, and that kids with disabilities couldn't enter the schooling system, so I started the Empowerment Through Partnership Trust, which raised funds for other kids' equipment. I used that to build communication devices for other kids, and also started, together with another group of parents for children without special educational needs, and eventually a resource center for inclusive education. At the same time we were doing this, we were raising funds to cover the costs of our influencing policy so that it could change and include children and education for all. And we got the policy into place and the government changed, and I was working in the community because now my daughter was at school. And what we were actually doing, we were playing with policy while absolutely nothing was happening on the ground. So the next challenge became, I've managed to teach my daughter to read, I've managed to get her into mainstream school, but what about all these other kids? And how can we turn the policy we've worked so hard to get actually into practice on the ground? And one of the main problems that we're experiencing was without the right wheelchair, a child cannot get to school, they can't even get out of their bed, let alone out of the house. And one of the foundations of this is the principle that a wheelchair is a medical responsibility. You cannot just give a wheelchair to somebody because it suits you to push them in it. It's part of their body, it's an orthosis. And you'll see here, this young man was one of the first guys I came across in the rehab where I was working with kids on a voluntary basis. He had attended a really good school, had numerous operations, and every time they put him back in the wrong wheelchair, and he developed serious secondary health complications. So for me the challenge was, how do we find ways to serve this greater community that is affordable and sustainable and becomes the responsibility of government? And ultimately the end result of that must be that it facilitates change and improves the quality of life of those children. And it was through that work that I was invited by the World Health Organization to help them construct a global guideline on wheelchair provision in under-resourced regions. Because this was what I discovered is happening. Over 70 million people need wheelchairs and don't have them. And what donors are doing all over the world, especially in the first world countries, they're either delivering all their second-hand rubbish here and dumping it in large container loads in poor countries as a solution and a good feel-good tick box, or they're manufacturing real cheap, really inappropriate devices and handing those out. So the wheelchair definitions that we came up with and the guidelines support a wheelchair that is appropriate for the user in many different respects. It has to be right for the individual's physical needs, for the environment, for their fit, and it must be maintained and affordable. Because literature surveys have proved that 80% of all wheelchairs need to be adapted for the user, and all children who need wheelchairs will develop spinal deformities if not properly supported. But funded priorities are very different. So I started Shonaquip purely from peer pressure. Parents wanted a solution and there was nothing else around, and I felt really uncomfortable charging people for equipment and making a profit out of wheelchair sales or my knowledge. And it took me a long time to take the leap, but I had been so burnt in the NGO sector by grant funders who had changed their fashions, changed their plans, and dropped our projects that I didn't want to start another NGO. I wanted at least to be responsible myself if something failed. So I started a CC. I didn't know what a CC was, but somebody told me a CC was a good idea, so I started a CC. And our solution was to create long-term plan and vision, build a range of clinically sound devices, develop training and outreach community support services, do research to back what we were doing, and make sure that what we were doing was really financially optimized to be cost effective. And of course to continue with policy and influencing standards around wheelchair design and development. So a long-term plan and vision really revolves around the need for services to go out to the people. How can somebody in a wheelchair with a child and maybe another child and no accessible transport get to a hospital? How can they access those services? So we've started now 20 years ago creating outreach community services which really build capacity in under-resourced regions. We have sound range of devices. We train people in the community on how to assess, measure, prescribe, fit and modify the devices, and also optimize the value in the budgets. We build a lot of research partnerships with the universities and with international people, and I continue to work with policy and standards. Now, over the 20 years, we've had huge challenges, because in the beginning there was no industry in this field. We started with nothing, and we've created a new market. And in that process, that market became really competitive. And it was something that, as not being a business person, I was completely unaware of. I was busy serving the community. So when ordering in government, and we managed to get tenders in place and government responsibility, but I didn't see the problems coming because I didn't have business knowledge. And we had to cut back significantly in 2011 after the World Cup and the breakdown in ordering cycles. So the last 2 years we focus now on how to restructure in a way that is far safer and one that takes the responsibility off the company and puts it out there in many more places. We turned the CC into a PTY, and I transferred shares into a foundation. The foundation and the company work still hand in hand as the social enterprise. But our activities, although separated on paper, and the legal entities, although separated on paper, still are carried out within the social enterprise as a whole. So time for the therapists is spent in the company, and then they have a percentage of time they can spend in the foundation. The foundation raises grant funding, and it also raises income from the sale of appropriate holistic services, but the business sells product to government and private sector and provides a much more professional service in terms of working with professional people. The model as such is something, everybody says I think like a bowl of spaghetti, so I suppose this is a bit of a separated bowl of spaghetti. The company generates profit. That profit is used to grow the company, and what isn't used to grow the company, or depending on our priorities, is put into upholding the foundation's mandates to supporting better quality of life for people with disabilities. In providing a backing for the foundation, all donor funding goes directly to the projects. So this year we're expanding our model into a number of new countries. We're building what we're calling wheelchair development hubs with small partners across Africa, building component parts of new designs which are flat packable and easily assembled off-site in remote areas. And we're working with the World Health basic and intermediate training packages, which we've developed with a whole bunch of people globally to actually upskill local community rehab workers and professionals on how to support those services and take them into the government sector. So our outreach clinics are really looking at ensuring that the most appropriate wheelchairs get to the people who need them, that skills are transferred, and the hubs will be self-sustaining, income-generating development hubs in the country where they're needed, bringing income to the places where it's needed. So Shonaquip's model is really one of change agents. We lobby, we do the work, we influence the policy, we make enough profit to grow, and we feed that back into the cycle. At the moment, I'm working to simply document and illustrate our hybrid social model of business for good. And I want this not only to clarify our position for funders and grant makers, because there's always a question about what is business and what is foundation, and some people get nervous. But I want to really understand it and let other people understand it. That this new model of business is not only possible, but it's necessary in order to respond to people's needs in a really changing environment that we're all living in.